All right, everybody. Thank you so much. We're going to go ahead and get started. First, just want to take a moment and welcome you to today's webinar. My name is Jennifer Dixon. I am the Senior Director at Goodway. And today we are going to get into some really fun stuff. We're going to explore how us as healthcare marketers can still deliver personalized experiences while navigating this complex and dynamic world of new regulations. Our goal today is to discuss how we can navigate this world without sacrificing marketing performance. So we are looking forward to a great conversation. You'll see here, Michelle, our tech assistant for Goodway, just popped into the chat. You can feel free to ask questions. Use the QA, and that will be just for the panelists to see. Ask questions. We are going to save some time at the end of the webinar, about 10 minutes or so, to talk through some of the questions that we have. So let's get started. Quick introduction to our panelists. We have Erin Killian. She is the Director of Client Strategy for Healthcare at Gradient. Gradient is part of Goodway's digital agency. Erin helps create digital data-driven solutions for our clients to navigate this complex world of healthcare. She is also a member of Shushma and has a strong hand in helping provide resources and kind of the education agenda for that society. And then we have Scott Blessman. He's the VP of Analytics and Data at Goodway. Scott is an analytics expert with experience in helping brands grow through strategic and actionable insights. And then we have Carter Main. He is a data insight analyst at Goodway, specializing in data-driven marketing strategies across both paid and organic solutions. Thank you, everybody, for joining us today. Let's get started. We are going to pop a question here in the chat for everybody to participate and answer into. So there should be a Mentimeter question coming up. Thank you, Matt. So the question here is, how confident are you in your current strategies while navigating PHI regulations while maintaining marketing effectiveness? So on a scale of 1 to 10, excuse me, 1 to 5, 5 being very confident. Perfect. Okay. So maybe not super confident, hanging out in the middle here. Perfect. Awesome. Well, good. So let's jump in and kind of tackle some questions here and see if we can help make everybody feel a little more confident leaving today with some strategies and some practical tips. I'm going to start with Erin. Erin, can you talk a little bit about some of the biggest challenges that you feel healthcare marketers are facing with the new regulations from the FTC and some privacy state laws? It'd be great for you kind of just to hear your point of view on that.
Yeah, absolutely. There are tremendous challenges that we're facing. Can you hear me, Jen?
Yes.
Okay, perfect. So of course, we know that marketers are facing these challenges across the state privacy laws, across the FTC and HHS guidelines, and just in general, when you look at how consumers are expecting their personal data, especially when it comes to health, to be handled, to be managed, to for HCOs to really leverage in a way that is helping them helping them in a personalized way, but is still very, very cognizant of privacy and protections. And so while we know these exist, we do also know that this is forcing healthcare organizations to really sort of zoom out, right? And you might not be able to be as targeted on that one-to-one level that like we used to be able to, but really it's forcing us to more heavily lean on creative assets. It's forcing us to think sort of outside the box when it comes to some of the targeting approaches. And then of course, it's forcing us to look at healthcare not in a silo, to really look at how that omnipresent perspective of a consumer or a patient, how they're ingesting all of these different messages, and how that plays into their overall consumer journey. So while we have sort of lost this ability to specifically target based off of, ailment or ICD-10 code or whatever, we may have been using in the past, it does actually sort of allow you to take a step back in that patient journey and reach people earlier within their journey in a way that is more sort of, like I said, omnipresent.
That's great. You talked a little bit about creative and relying on creative a bit more. Can you talk about kind of your experience with collaborating with creative and creative agencies to really refine that messaging to help drive business outcomes for our clients?
Absolutely. Yeah, I think it's a great opportunity. Over the last couple of years, we've seen creative agencies being forced to sort of get down into the nitty gritty of, we want this one-to-one messaging. It has to be very specific to the hyper targeted audience that we're looking to address. And I think that this gives you an opportunity to really look at, from a creative standpoint, creative strategy, look at the pain points of the patient, look at what the barriers to entry are for them, right? Is it access? Is it transparency? What's keeping them from seeking care? And what's keeping them from seeking care at your HCO? And really, it's forcing creative agencies and strategic agencies to collaborate a lot closer on really getting to the bottom of what those pain points are, and then figuring out ways to convey how your HCO directly addresses those pain points, instead of really focusing on sort of like what what we all know that our board of directors and what our higher ups or stakeholders necessarily want to promote or push, what the docs may want to push or whatever the case may be. Really, this is forcing us to look at what's driving patient behavior and keeping that in the forefront, because that is what's going to help you segment and target a lot better. Now that you can't get that hyper targeted, you don't have that micro targeting ability anymore. So really, you're looking at your creative to be that targeting when you're using broad audience data.
That's great. Thank you. So Scott, we heard Erin talk a little bit about, creative and consumer privacy, thinking about all that fun stuff from a data collection and measurement standpoint. One would say that you've had to get pretty creative on that side of the house too, to navigate this new normal. Talk to us a little bit about what you're doing to overcome some of these barriers.
Yeah, so a lot of what we're doing is taking advantage of the data that we have available still that doesn't get down to that one-to-one user level. We're not risking an exposure of their PHI or getting too close into that kind of what in some marketing channels we could call that creepy factor, where we're a little too targeted, maybe a little too specific. But the good news about that is we can utilize a lot of our delivery mechanisms that we have today. We can still look at creative messaging to see maybe what's getting the most engagement, what videos are seeing the best completion rate, and how that might be lifting overall aggregated metrics. And the key there is aggregated. We do not want to be looking at data at that click ID level or that user ID level or that device ID level, because all of those fall within that identifiable information. Where we really want to lean in is, what do we have at the front? What are we driving from a delivery and engagement standpoint? And then what on the back end are we seeing from this aggregate approach? Are we seeing a total lift in overall activity, overall interest in people researching a page, but not drilling down to those specific conditions or drilling down to that very specific like appointment, which we would normally be looking for?
That's good. With kind of this new normal in the analytics world, I would think that these conversations with our clients that we work, have really kind of, pushed them to think a bit differently too. Can you talk a little bit about how you've engaged with some of the clients to bring that data to the forefront that they historically maybe haven't thought about bringing to the forefront, that you've been able to lean into to help performance?
Yeah, that's a great question. The way that we have been approaching these conversations is varied. And a lot of that deals with the sophistication of the data that the client has available. There are a lot of third-party companies that have popped up recently, recognizing the gap within healthcare. Some of them are former LiveRamp employees who realized the LiveRamp solution wasn't maybe hitting that privacy that we'd like to see in terms of that PHI. Some of them are existing companies who recognize the extra layer of protections that need to be in place. Because even a hashed ID could, in theory, be decrypted, and we could get down to that user level data. So using these, we think about them very similar to what we would do with identity resolution, kind of at large. But what they're doing is obscuring that data as opposed to delivering it back to us. So it allows us to basically see kind of like those top line activities, but we're not drilling down into that individual person. We're not looking at zip codes or email address or some of the other things that we might use to target consumers on other channels through other industries.
Oh, that's great.
Jen, I'd love to add in just on that.
Awesome.
I think there's also a unique opportunity for us to really lean on, especially from the agency or the support standpoint, lean on the healthcare organizations to share with us in an aggregate form, right, the reports from their EHRs, to look at broader metrics, broader business goals across the campaign, right? So whether it's volume, utilization rates, whether it's readmission rates, whether it's all of these different things that we know, CAP scores, we know that those are or HCAP scores are such an important part of, developing and understanding where your brand sits within a market. These are all great sort of benchmarks. And then how do we look at, in that 6-month window or that 8-month, whatever time frame we want to look at, how can the efforts that we're making through advertising and marketing, how can that help to increase your volumes and your utilization rates? How can that increase, or improve your HCAP scores? How is that actually helping your star ratings through, Medicaid, Medicare, that sort of thing? Those are, obviously, you may have to do a little bit of scratch math or, make some causality, but definitely something that we should be taking a look at, sort of as a benchmark, and then to help measure throughout the campaign.
Yeah, that's great. I think those relationships Erin's talking about are really where those opportunities exist. And looking at kind of how are things moving together. So that's where I was going with my capitalize on the data we do have and think about what are we seeing from a delivery and engagement standpoint, and then being able to tie how that shift might be seen on the ultimately on the healthcare provider's end.
I love that. And Carter, I think that's a perfect segue into what I would love to hear your perspective on is we have data. We've talked about creative. We've talked about leaning into aggregate reporting. But at the end of the day, what are some practical tips that you've seen on the front line that help our clients navigate this new normal?
Yeah, if this hasn't become abundantly clear yet, the word of the day is aggregate. So if we say it over 10 times, everybody here wins a prize. So what we're really talking about here and what we've helped our clients navigate is really moving from a one-to-one attribution model that connects back to in-platform, whether that be Meta, whether that be the Trade Desk, Google Ads, you name it, over to an aggregated sort of view. So what we're able to do is utilizing UTMs. We're able to pass that information, obviously, off to the compliant analytics platform, able to ingest that information, and then we get that, in turn, that data back in aggregate. So what that allows us to do is really make near real-time optimizations based on, event performance, or not event performance, but on-site performance. That allows us to make those optimizations just from a manual perspective, as opposed to relying on those conversion-oriented bid strategies within Meta and the Trade Desk. So it does involve some pretty active hands-on keyboard, just in terms of what you're going in and optimizing against, and making sure that your campaigns are still performing. So you're able to go in and match back, my X campaign and Y ad group spent this much for this 2-week period. And then taking that information back from the compliant analytics platform at an aggregated level to say, okay, we saw 13 events that looked to be aligned with what we were expecting out of this. So then we're able to reverse engineer some conversion rates and cost per acquisition, and then we're able to go in and make those manual optimizations. And then once you get into more upper funnel tactics, we start to look at things that are a little bit more directional, because those aren't so click oriented and the UTMs aren't going to be of as much help to us. So things like video, advanced TV, display, you're going to start to look at your branded search volume. So what you can lean on for that is things like Google Search Console, seeing how your branded search performance is lifting relative to the benchmark before your media was in market. You can even target your branded keywords within Google Ads and keep a live pulse on your search impression share for branded searches on your dedicated keywords. And then lastly, you can go into your analytics platform and see how your acquisition sources are changing and seeing if you're seeing a lift in organic search. Because if somebody's not clicking your ad, but they were impacted by video or display, what are they going to do? They're going to go to Google, type your brand name in, and then click on the organic search result. So those are just a couple of the ways that we've helped navigate. It's really fundamentally a transition from, a maximize conversions bid strategy within the platform to a maximize clicks bid strategy. And then utilizing UTMs and events and passing those back, and then sort of just reverse engineering those conversion rates at an aggregated level to make real-time performance updates. And I will mention something specifically that I have experienced being in the day-to-day management of SEM specifically. Once you do make that change in Google Ads, you will see a pretty significant shift in where they're allocating dollars, clicks, and impressions at the individual ad group level. So it really helps to compare a before and after of when you did make that change to see, where Google is really starting to allocate your budget and impressions and clicks relative to what it was doing previously when it was optimizing toward conversions. So if you don't on day one have those UTMs and events set up to reverse engineer those conversion rates, that is certainly a great way to go back and sort of make sure your performance is aligning with how it was previously.
That is great. Some very, very practical tips for that, Carter. You've heard me say this before in our conversations, and our clients have heard this too, is, just because rules and regulations have changed, consumer behavior fundamentally hasn't changed. So can you talk a little bit about like what our clients are seeing from the business side? Have they seen a business impact? Are we still driving that business outcome that they want? Talk about like that kind of view of it.
Largely, yes. And I think we have the visibility into those mid to lower funnel tactics on a better level. So we're potentially looking at it through rose-colored glasses, but that's where it becomes helpful to have those candid conversations with your client to say, how is the business actually performing? Because, we're not optimizing toward those top of funnel actions anymore. So I think, like I said, it is certainly possible that, get tunnel vision and look at, Meta and, Google Ads and Bing are still performing well because we're able to have visibility into, what's happening at the aggregated level. But I think, it's still important to have those candid and open conversations about, are we still meeting business goals? Are those phone calls coming in that are actually interested in making appointments, or are these people not even remotely at the stage that we need them to be at or where they were at previously when we were optimizing toward those very specific events? So I think that's a very important supplemental way to figure out if your media is still performing when you're losing that visibility into those very specific conversion actions that you were previously optimizing toward.
Yeah, I think, Carter, that's a great point, right? Like, we know that nothing happens in a silo when it comes to healthcare. I mean, when it comes to most advertising things, but healthcare specifically, right? And so, what other elements or what other things might be contributing to that rise or that decrease in these actions happening, right? Like, are you looking at your referral patterns? Are you looking at, just once again, your overall utilization and volumes? Are you taking into consideration the competition in the market? Are you looking at access points? All of those different things really do play into it. So I think this is great that we're not looking, I think we all like to look through rose-colored glasses, but like the fact that we're not looking at just one-to-one data and that we actually do have to look at it at an aggregate level, because that's truly, I think, more indicative of what's going on in the market and what HCOs are seeing sort of at that business level too.
That's great. Thank you, guys. We are gonna pop another question into the chat here as we kind of round out the last few questions for the panelists, but would love everybody to click on the link and take a look here. So what is your top priority when it comes to targeting healthcare consumers? Multiple choice here. So we have compliance, consumer trust, ROI, innovation. All right, so yeah, we have compliance, ROI. These are great, great. All right, so let's jump in here and talk a little bit about if you had to, think about all these challenges and everything that we're here. What are some of the strategies that you would recommend for our healthcare folks here while making sure those business goals are met? Erin, I'd love to start from your perspective. If you could talk a little bit about what are some of those key strategies that you would recommend?
Absolutely. I think first and foremost, make sure you check with your compliance team and your legal team, right? Like just putting it out there, guys. This is not legal advice, right? And I've got to keep legal happy on our side too. But make sure that you are in fact checking and make sure that you are defining sort of what your risk tolerance level is, right? At Goodway Group and Gradient, we are incredibly risk adverse. We are actually seeing a lot of our vendor partners sort of fall in line with our incredibly risk adverse approach and our conservative approach to what we can and can't do and what we will and won't do when it comes to targeting and measurement from a healthcare perspective. So that would be my number one thing. Also, plus one to get that little plug about this not being legal advice. When you actually look and you're attempting to still engage with your audiences, I think really zooming out, right? So like when your service line leaders come to you and say they want a specific campaign in the market to promote XYZ, right? Like find out from them what their broader business goal is. What are they trying to accomplish with this and why? So don't, and I know it's a lot easier said than done, but don't be afraid to ask those questions because the broader business goals are what's really going to help you identify what the greatest opportunities are. And then it's going to help your partners identify what the greatest opportunities are to truly capitalize and engage with those, with that audience. I would also say really zoom out, right? Like figure out where this fits within the patient journey. Figure out where, is it an urgent care message? Is it a cardio message? Is it, wherever it may fall, figure out sort of where they sit and what the mindset of that consumer, that patient might be during that time, and figure out, how can we leverage data outside of their, the ICD-10 codes, the ailments, the prescriptions they're taking, that sort of thing. How do you leverage what are the other things that are going on in their world? And then, of course, I would say, one of the biggest things that we recommend is leverage contextual. I think contextual advertising has sort of fallen by the wayside over the last several years, especially in healthcare. Contextual advertising is incredibly effective, especially when it comes to targeting people who are doing the research, who this message is relevant and real for. And it's far more effective when it's in situ and it fits sort of within the framework of what they're looking at, what they're ingesting. We've seen all kinds of success across not just programmatic contextual, but really leveraging it across OLV and CTV. There's new opportunities that are sort of arising every day to do that, and so definitely looking at that. And then really manage expectations and redefine success. For the last several years, we've really been looking at success being X number of form fills or X number of appointments or click to calls or things like that. And I think it's really crucial that, internally and externally with your vendor partners, and then of course with your stakeholders internally, that you redefine what success looks like for your organization. And, knowing that compliance is such a huge thing and that privacy is a huge thing, and that patients do want personalization. They do want to feel like you're talking specifically to them. How are you still managing that? But what are you defining as success? And then one more, sorry. And then finally, I would say definitely leverage internal assets, right? I mean, we know that patients, consumers, they want personalization. While you might not be able to give that to them across broader advertising efforts, you can still communicate with them through various nurture streams across EHRs, across text, direct mail, email, messages, et cetera. Those are all ways that we do know that patients and consumers want to be communicated with when it comes to their healthcare, because it does feel safer to them. It feels like their data is more protected. And so that is a great opportunity to leverage the information, the data you already have, to Scott's point earlier, to really capitalize on those opportunities.
That was a robust list of strategies. So hopefully our attendees can have a starting point. Thank you for that, Erin. Scott, I think data can be slightly overwhelming, right? In this space, there's a lot of data. It's very personal data. Where would you help direct our attendees to start with their data?
With any data, whether it's healthcare or any other vertical, my biggest starting point is think about what we're trying to achieve. So each time we have an opportunity to talk to a potential patient or potential consumer, what are we trying to do at that moment? Are we trying to inform? Are we trying to drive them to action? Are we just getting them to think about it? And then kind of root your data in those desired outcomes or those desired next steps that we want. This helps us get out of that one-to-one mindset, and it really puts us into that, okay, overall, what are we trying to do for the brand? Overall, what are our goals? And knowing that each one of those touch points is an opportunity for us to then track or learn something else about performance or what we're doing. Looking at things, again, like Carter mentioned, do we have the right UTMs in place, and understanding if our action or desired outcome is that we want people to come to the website, what are we seeing on the website? If our desired outcome is just folks to start researching more, are people going to areas of service pages or starting to do even some organic searching on the site? And just understand where that opportunity lies on each one of those touch points and what we can do to actually move those things forward. Knowing that, we can start by saying, all right, we've got this list of metrics. We know kind of what levers we could pull at each one of those touch points. What next? And then think about, okay, based on compliance and based on the understanding that your team has in terms of risk averse or being a little looser towards risk, what data points do we have available on our side, meaning on the healthcare provider side, that can help then reinforce or re-engage with what those desired metrics are? So again, if the goal is to go to the website, did we see more people come to the website, and did they look up specific areas of your page, and did you see a lift in overall appointments or consultations or whatever? That's really where we need to think about it, is taking it down to that bare level and taking it down kind of to that, the way we did it 10 years ago, where we were really looking at how trends and shifts move together based on where we had that chance to talk to the consumer.
That's great. Thank you, Scott. Thank you. Thank you. Awesome. Well, let's take a look here. I think we have a couple questions in the Q&A. Let's see. Yep, we have a question here. So it seems that some states in the US have stronger rules than others. Do you foresee any new states in 2025 taking a more stringent stance? Erin, I'll let you tackle that one.
Yes. So, yeah, I think it's going to depend a lot on the election coming up. I think that's going to determine where states kind of fall on this whole concept of privacy. I think that, several states have have privacy laws in committee right now. They have privacy laws sort of, that are rolling out in 2025. So I think it's really important. There are several resources out there that you can use to track sort of what those are. But just, keep in mind that this patchwork is going to make it kind of challenging across the board, which is why we tend to recommend that, you leverage, pick one and sort of apply it across the board, maybe pick the most stringent one. I would say, you have Washington's My Health, My Data, which is extremely conservative. You have CCPA in California that tends to be a pretty good sort of litmus test across the board. But yeah, we will continue to see more states taking on these stringent stances, specifically as we see what happens, like what the outcome of this political season is.
Awesome. Thank you. So at this time we have no other questions here, but again, we have covered a lot of ground today. So please, as questions come or you think about other just dialogue, if you want to have a conversation with us, we're going to have Matt pop up a contact slide here. I would also just like to say that we will be sharing a recording of this webinar along with some additional resources to navigate these privacy challenges here. We will also be attending the conference out in Denver at Shishma. We'll be there for the 13th through the 15th. We have a dedicated session in the learning hall Monday at 11, so please stop by. Would love to continue the conversation there. I would like to also thank our panelists. It was a great discussion and we look forward to seeing everybody in Denver. Thank you all.